Hello and welcome back. One of the things I deeply appreciate about public health is how it tries to take the big picture into account when it addresses a health-related issue. Now, the easiest answer to where a disease comes from is to point to the factor that seems to immediately be causing the health crisis. This is called the contributory cause, and is typically a factor which seems to be directly related to the disease. For example, research has shown that HIV causes AIDS and the subsequent health impacts. However, another way of looking at it focuses on the factors which led to the identified contributory cause. These factors are called health determinants. They could result in exposure to the contributory cause, or perhaps influence how bad the impact would be. For example, failure to use barriers during sex is a behavioral determinant of acquiring HIV. Now let me tell you a quick story, which I'll call the parable of the stream, to illustrate how determinants function. So Mo and her friend are on vacation and are hanging out next to the river. Everything is delightfully relaxing and they're having a great time. Then all of a sudden a child comes floating down the river, dangerously close to drowning. Mo jumps in and pulls him out. But just as he gets back to shore, another child comes down the river. And then another and another. Some are mostly okay, but others are pretty close to drowning. Her and her friend keep on fishing the kids out, but they are getting exhausted. So Mo tells her friend she's going to go up the river to figure out what's going on. As she goes up the river, she finds that there is some bad rapids. The kids are getting battered around and bruised so that even good swimmers have difficulty keeping afloat. So she throws them branches to help them float and continues up the river. Right before the rapids, she finds a woman who is telling the kids about how much fun it would be to float down the rapids. It would be just like a water park slide, she shouts. So Mo tells her to quit encouraging them and continues up the river. Then she finds a nice calm pool, but it turns out that by policy there's no lifeguard on duty during weekdays. So there's nobody there to warn the swimmers about the dangerous rapids downstream. So what does this story illustrate? Well, there are determinants far upstream which make a big difference. In many cases, there are larger political or societal factors which weren't decided by or intended to influence the individual. The example here is the policy regarding lifeguards, which needs to be fixed. Then there are midstream determinants. These are factors which influence an individual, but are part of a process such as peer pressure or community-wide impacts. The example here is the encouragement to enter the rapids, which would impact multiple children. We then have downstream determinants. These are impacts that impact the individual, but may not be shared across groups. For example, some of the children got bashed by the rocks in the rapids, so that they couldn't swim, while others went through without harm. Finally, we have the contributory cause. This is a factor which is most closely related to the health impact of interest. So in this case, the contributory cause to the drowning would be the water entering the lungs and preventing breathing. So what lessons have we learned? Well, it is really important to think about the origins of health problems. You need to keep on asking why to identify root causes if you're going to be effective in preventing illness before it occurs. This can be really challenging in public health because sometimes these causes have happened decades before. For example, some adult onset cancers can be caused by exposures in childhood. It's also true that it may take a while to even understand why these determinants matter. Sometimes we may take action to influence them before the natural history of the disease is even clear. But the point of all this is that we know more about upstream factors which cause the disease, the more different possibilities we have to change something and prevent it. It will often be possible to decrease risk for the disease at different points in the process to achieve different goals. Also, sometimes people who do public health will try to influence it at multiple points. That being said, it is often the case that the further upstream towards the root cause of a disease you can get, the bigger the impact you can have on overall prevention. Now, what are these health determinants? Well, there are many different ways that health can be influenced. Riegelman outlines a few of them using his acronym BIG GEMS. This can be helpful for remembering and keeping track of key determinants. So what are they? The first is behavior. The choices people make and how they behave in the world can make a huge difference on health. For example, brushing one's teeth, exercising, and smoking are all behaviors that can determine health outcomes. Infections can make a difference too. We are increasingly finding that infections can make people more susceptible to a wide range of diseases. For example, people infected with Epstein-Barr virus, which causes mononucleosis, are more likely to develop lymphoma. And people who get HPV are more likely to experience cervical cancer. Genetics has a large influence on many health-related factors. Sometimes this is a very powerful influence, such as the development of sickle cell disease. However, it can also be more subtle. For example, changes to KCNJ11 can slightly increase disease for type 2 diabetes. Genetics can also be protective. For example, high levels of melanin is helpful for preventing skin cancer. The geography of where you live can also determine what risks you're exposed to. For example, exposure to malaria is more common in tropical areas, and you're more likely to experience sunstroke in Phoenix, Arizona than you are living in Seattle. Similar to geography is the environment, which plays a huge role in health. This can range from global impacts like climate change to exposures to lead or risk for poor building designs that crumble during earthquakes. Whether or not people have access to medical care is also tremendously important. There are many examples of ways this influences health. For example, insurance access and affordability, poor coordination that creates delays in care, or lack of cultural awareness among healthcare workers. There are many social, economic, and cultural factors that need to be considered. In fact, there's a whole set of related factors which have been listed by the World Health Organization and other groups that are called social determinants of health. These shouldn't be confused with the big GEMS determinants of health, which are the overarching factors. Now, just to provide some examples, we could consider how legal structures and social biases influences homelessness, how employment determines ability to buy needed medications, and how cultural perspectives on eating meat impacts diet. So that's the big GEMS framework for thinking about health determinants. Again, the point here is that we're trying to move away from just the direct contributing causes, and instead see the big picture, where many upstream factors make important contributions to health states. This will help us to have more opportunities and flexibility in figuring out how to help keep the public healthy. Well, that's about it. Be well and take care.